What are the common errors and mistakes that you're facing nowadays?
Well, in IRITA now, in 2020, aesthetics is a big worldwide interest. Everybody wants to go into aesthetics. Image is super important. And there are, sometimes indications which are not justified, which are not just medical, which are not aesthetic but unaesthetic. I call them, the extreme transformation, extreme relooking, and it comes mainly from that, both from patients who are, asking, too big transformation, and also from doctors who are either proposing or accepting this transformation. So, when, for example, a patient is coming for a lip augmentation, and she has already, big lips, it's my job to educate her. I think the two keywords in this answer are indication and education. Indication, it means if you choose the right technique in the right patient, well, it should be okay. If you are choosing, incorrect or unjustified technique in the wrong patient, you are at risk of complication, bad result, etc. So I need to choose a good indication, and for that I need also to educate the patient, because the patient, they don't think like you. They are, looking at picture in media,
they just
internet.
Want to copy paste of that.
Exactly.
Picture.
So
how do you handle this kind of?
So we have to educate them.
Okay.
Education, it means for you, this will be good, this will not be good. So give you an example also with breast augmentation. Breast augmentation, has to be related also to the size of the torso, of the width of the shoulders, and you cannot, do the same volume in a tall 1 meter 80 centimeter.
But if you
woman.
face like a stubborn clients, for example,
Yeah, so
they just want to do that.
Yeah, they just want to do it, and I'm also as a doctor. As a doctor, I have the right to say no, and this is very important, to say no to the patient. If they are stubborn, as you say, I don't want to risk them anything, and I don't want to risk
your reputation.
My reputation neither. So very often in a consultation, I say no. I try first to educate them, to explain them, to say this is the right indication, this is not. And if they are still with a precise focus idea and they don't want to listen to me, well, I say no problem. You refuse.
Of
course, we are not as a doctor obliged to say yes. Of course, we are. We have the obligation sometimes to assist, but it's true for everybody. For example, if you faint now, I have to assist you. This is an obligation by law. But by law, I'm not obliged at all to treat a patient who has an unjustified, request. So I will say indication, education, and very often saying no.
Okay, so let's go back to our topic-related questions.
Yeah.
I know you are one of the anatomists in this aesthetic field. I want you to explain a bit more what is anatomy.
First of all, there is no one anatomy, there are several anatomies. First of all, the descriptive anatomy. The goal is just to describe the anatomy. This is what doctors learn when they are 18, 19, 20 years old on the bench of the university. They are not clinicians, they are not practitioners. This is just one subject among others, and they need to know the descriptive, the morphological anatomy, how is built the face, how is built the heart, the limbs, etc. So it's not related to practice, it's just description, okay? Yep. But nowadays, when we are, as me, a practitioner, and with my colleagues, we are not so much interested in descriptive anatomy. We need what we call clinical anatomy. Anatomy related to the clinics, to the practice, to the patient. to
the
patient.
doctors or to the patient?
No, to the patient.
Okay.
To the patient. It means we need to the techniques. You know,
Techniques.
when I'm going to inject this, or when I'm going to operate, to do this operation, what is the anatomy, the relevant anatomy I need? You see what I mean? When I do breast implant, what is the anatomy of the gland, of the pectoralis major, what is the shape, the size. This is, you know, a useful anatomy. So this is number one. Number two, anatomy is, describing all the elements of the body. You have the skin, you have the bone, you have the vessels, the tendons, the nerves, the muscle, etc., etc. So there are many components in the human body. And we have, for example, for the vessels, what we call the vascular anatomy. For the muscle, the muscular anatomy. So every component can be described, you know, very specifically. And for example, in aesthetics, one of the most important anatomy is the vascular anatomy, the vessels, because when we inject fillers, for example, or when we operate, to know where are the vessels, to avoid them, or to announce them to achieve a better healing after surgery is key. We don't want to risk any skin necrosis. You have heard about bad complication after surgeries or after filler with the skin getting necrosed. It means black without blood, or after surgery wound dehiscence because the blood was not enough in the surgical wound. So managing the blood vessel is really key. So vascular anatomy is one of the most important in aesthetics. And then we have also, you know, a difference between ethnies. The anatomy between Caucasian, Africans, Asian is not the same. Even between us, Nairita, you are a woman, I'm a man. We know that there is a different anatomy feature. Look my chin, look your chin. I have a wide chin, you have a pointed chin. So we have to relate it also the anatomy to the sex and also to the age. The anatomy, you know, change as we age. The anatomy, you know, is of our face, but our body also is evolving. So you see, we cannot resume the anatomy is only one word. It's a very, very wide subject, and we have to know as a practitioner, as a clinician, all these different anatomy. And also, don't forget anything. We are all asymmetrical outside. When I look at you, even if you are very pretty, I can see that your left side is not fully the same than the right side. And look, it's the same. My left side is not the same than the right.
Yes.
And it's exactly the same inside. We are asymmetrical outside, and we are asymmetrical inside too. So our anatomy on the left side is not the same than on the right side. I'll give you just one example. There is a big artery here in the face. We call it the facial artery. And they are, from the jawline to the nose like this. And when we dissect, in the anatomy lab, this artery, these two arteries are completely different on both sides. One is big and one is small. So you have a dominant and a non-dominant side, like for the hand. This is the same with the anatomy, and this is why anatomy is so interesting. It's for me, it's really a passion because it's always different. If the anatomy was always the same, if the women were always the same, or same for the men, it will be boring.
Sure.
But this is the good point of anatomy. It's so variable, and I would like to conclude with anatomy is all about variation, and variation makes really the interest in this subject.